Hey guys, Don here. I want to talk to you today a little bit about using checklists in your treatment protocols. And basically, this is something that I learned because over the years, when I've been seeing patients, a lot of times we get overwhelmed with the amount of treatment options. Let's just take one, for example, plantar fasciitis. There are tons of different treatments. There are orthotics, there are shockwave, there's amnio injections, there's cortisone injections, there's pads, there's over the counter inserts. And it just gets a little overwhelming for patients. And when we talk about protocols, even with protocols, it can be a little overwhelming. Okay, first visit, we're going to do this. Second visit, we're going to do this. I found something that works a little bit easier, a little bit slicker in my hands, just works. It's using a checklist. So basically, a checklist has everything that you usually do to get 99% of your patients better. And with this checklist, the way I use it, I might use it the first visit, but when I show the checklist, I say, okay, Mrs. Jones, here are kind of all the treatment options. I kind of walk them through them. They're kind of by category, and then I say, in your specific case at this time, we're going to do this. That's one way I use it in the beginning. But where it actually becomes more helpful is I had a patient this week that came in that they had I think, 4 or 6 sessions of shockwave. They've done physical therapy. They have orthotics. This gentleman has Achilles tendonitis in one, in the right foot, and then like plantar fasciitis in the other. And we went through all that. And so I pull up the checklist and I say, okay, yes, we've done the X-ray, we've done the ultrasound, and it also makes it a little bit more objective for me and the patient, because I can look at that and I can say, okay, well, the things you haven't done a walking boot yet. We haven't done, for example, the amnio. We haven't done another round of the focused shockwave. So I find that the checklist really works well for doing that. So if you haven't used a checklist, how do you make one? Basically, you take a Google slide and you put all your treatment options on it. That's what you do. And I kind of organize it by category. The one that I find most beneficial is this one on plantar fasciitis. So I have categories. I have imaging, which has X-rays, diagnostic ultrasound, and then MRI. And then I have the traditional treatments where I kind of put them in categories. Like for heal and repair, I'll put in shockwave, amnio, PRP. For reducing pain, I'll put cortisone, NSAIDs, and icing and contrast baths. Reducing tightness, I'll put in physical therapy, home therapy, stretching, and a night splint. And then reducing stress and strain, I'll put in taping, supportive shoes, custom orthotics, and ankle brace, and then a walking boot. And then I have some advanced treatments or like surgery or a second opinion. I'll put a little link on the bottom of this plantar fasciitis. You can kind of see the presentation that I'm using currently. And what I did recently is I moved the checklist up. And so you'll notice is that there's going to be a couple of intro slides, and then there's going to be a checklist. Why? Well, because it took way too long to do the presentation. In the beginning, I thought everyone really wanted to know about all the other treatments. So you'll see afterwards, there's a lot of other slides I wouldn't use. So if you want to try this one with plantar fasciitis, you might like it. Let me know what you think. Within this podcast on the bottom, you can see a place you can send me a message. And I tried to do it today. I would love to hear you guys put a message. You put your question on, and then I'll answer it. To do that, though, you have to hit it. You have to make an account with this Anchor program. Basically, it's Anchor your name and then your password, and then it'll send me the question. Then I can answer it. So I'd love to answer some questions via this podcast. And then also, if you want to learn more about Podiatry Practice Mastery, there's the link on the podcast. And our next group session is coming up. We're going to talk about webinars and how to use those in your practice for more efficiency. So register on Podiatry Practice Mastery. Okay, have a great day.